Welcome back. It is Breast Cancer Awareness Month, and already people everywhere are gearing up for the big Susan G. Komen Race for the Cure. That is where thousands of survivors and their family and friends are going to raise money for breast cancer research. Joining us more to share more about the personal journey to victory is, of course, Deb Song. She is a breast cancer survivor, and she is the Senior Director of PR and Communications at Susan G. Komen. We were hoping to have one of the doctors, but right now, Deb, we're happy to have you to talk this morning about this issue. Good morning.
Good morning. Thank you for having me this morning.
Well, let's start first of all talking a little bit about Susan G. Komen. Maybe you can tell us a little bit more about the organization. I mean, how did you end up getting involved in it?
So, funny enough, Susan G. Komen, just some background, is the only organization globally that has truly impacted research, patient services, community advocacy, and legislation work. So my first touch point with Susan G. Komen was doing PR for some of the top hospitals here in Chicago. I've worked for Northwestern Medicine, Advocate Healthcare, and other places. So I've worked very closely with a lot of doctors that did research that was funded through Susan G. Komen. But at a certain point, I ended up with breast cancer. And so I utilized Susan G. Komen services for patients for emotional support. And they did give a lot of emotional support to my family.
Well, I want you to, tell our viewers about your own personal journey with breast cancer. How did you find out? And then what happened? If you don't mind sharing that, please.
Yeah, I'd be happy to share. So my breast cancer journey, I unfortunately have a family history of breast cancer, but typically most women, 1 in 8 people, do not have a history of breast cancer and can get breast cancer. So in my situation, I was diagnosed actually on October 1st in 2018. And luckily it was caught very early on. So I was staged out very early. I did undergo a double mastectomy and reconstruction, but I was able to avoid chemo and radiation. So now I'm in my 3rd year of survivorship, and everything that I've kind of touted through, healthcare PR, working with patients, never expected myself to be the patient on the other end, but being my own advocate and knowing what I know was very important. And Susan G. Komen really helped me through that, through their helpline, really helping me understand my treatment plan, what options I had, and the importance of early screening. And I think that's what really saved my life. And I'm here today to tell my story.
And obviously the work that everybody is doing with Susan G. Komen, helping to support other women with breast cancer. Maybe you can share with us some of the initiatives that they're doing to help people when they need it at those key moments.
Yeah, I mean, there are a lot of great initiatives that Susan G. Komen has taken on. We've provided $1.2 billion in research dollars that have made such great movements within breast cancer since the organization started in 1980. Nancy Brinker, who started the organization, made a promise to her sister who was dying of breast cancer that she would make a difference. And now we are here today where we can diagnose people very early on, like myself, and have long-term survivorship. But we still have a really long way to go. And what I'm really proud of, Susan G. Komen, is the initiative they've taken with Stand for Her, which means the Health Equity Revolution, which is a true promise to make a difference in breast cancer amongst Black women. This is part of the reason why I joined this organization.
Well, we have joining us now is Dr. Funmi Lapade. Hey, doctor, thank you so much for coming on and joining the call here. I know we're running short on time, but I want to ask you, while you're here, what are some of the strategies that you want to focus on when it comes to breast cancer prevention and reducing high-risk populations?
Thank you very much. Really, just to add on to what Deb has said, I'm a Susan G. Komen scholar. And what they're interested in funding researchers like me who have been underrepresented in research and yet can benefit from knowing what my risk factor for breast cancer is. I'm a geneticist, and we know that some women have a higher risk than others. And because of that, all of us have to first think about ourselves as women, that we have a risk for cancer. And then we have to then think about ourselves, are we in a higher risk category? So We know that women who have BRCA1 mutations, who have BRCA2 mutation, who have a family history of breast cancer, they cannot wait. They cannot wait for this pandemic to be over before they go in and get their mammograms. And then for women who are living with breast cancer, I want to make sure that everyone has the opportunity to have the genome sequence so we can know how to target the best drugs for these women so they can have a chance to survive. So that's why I'm passionate about the race. That's why I'm passionate that Chicago is one city, that we're not just black and white, we're from all over the world, we're diverse, and we have our neighborhoods. But on that race day, we all come together for one cause, which is to end breast cancer as a cause of premature death.
Well, Dr. Funmi Lapade, Komen-funded researcher at the University of Chicago Medicine, thank you for coming on, and thank you, Deb Song, for sharing your cancer survival journey with us and our viewers. Really quickly, when is the race going to be?
The race is actually virtual this year on October 23rd. We are really looking forward to having everyone participate. If you can't participate, we hope that you will actually donate to one of our runners, walkers, riders. It's going to be a very exciting event, and it will fund research just like Dr. Funmi's research.
Great
so
information.
Thank you very much.
Yeah, thank you.
And because we're doing virtually, because we're worried about COVID, I just want to make sure that everyone gets the vaccine.
There you go. Hey, thank you both ladies for coming on. We appreciate it. 9:20 right now.